And we are live. Good Saturday evening, everyone. Welcome to Unapologetic Tea Time with your host, PG. That is me. Welcome to all of my loyal subscribers and to all of my supporters and people that are passing through, happening in, who may decide to check out this vlog podcast. Welcome. I hope that everyone is doing well. Hopefully, everything is a-okay with you as well as it can be out there in your neck of the woods, your town, your place, your city, and our state. With that being said, we're going to move right along swiftly and professionally this evening, folks. I won't stay very long, but I felt compelled to come on and chat a while. It is an important, I'm going to call it a fireside chat that we need to have. And whenever I deem things to be necessary and needs your attention, most definitely you can depend on PG with Unapologetic Tea Time to bring it to your attention. Once again, thank you for tuning in, and I welcome you all to my vlog and our podcast. As we all know, the holidays are fast approaching. We're already in the month of November, and tomorrow we will be just a little over halfway of this month gone already. So with that being said, Thanksgiving is just around the corner. I'm going to lay off of all of the politics right now, and I am going to focus tonight on our well-being. So I may mention a few things that are political to get my point across, but tonight won't be a political debate or a political viewpoint and or opinion. It's going to be straight to the facts from the federal government, the CDC, the scientists, the experts, and everything all combined into one. So with that little bit of a synopsis, you can kind of guess where I am going with this. And as you see on tonight's screen, it says choose with caution, Thanksgiving 2020 or COVID-19. And the reason I wanted to title this in such a manner is because it needs to grab you. It needs to garner your full attention, not just a little bit, but a whole lot, okay? Just kidding around, but really, folks, a whole lot needs to be focused on what I am about to talk about. And that is, right now, this month alone has been devastating to the degree that we have reached such a high number of deaths. We have exceeded records that we did not even see back when the coronavirus in the United States was first beginning back in March of this year. With that being said, the winter months are up on us. Fall is already here. We live in a large country, so we have various degrees of winter, various degrees of fall. Some folks have already seen snowfall where others have not. Some folks are still reeling from tropical storms, tropical depressions, hurricanes, tornadoes, and all in between. and then add in to the mix of politics, an election, a debacle, and the coronavirus. Hey, Tim, I'm great. Hopefully you are too. Um, but with that being said, it's unfortunate that the numbers that we see are the numbers that you are hearing about if you choose to watch the news or tune in to the news, um, on a regular basis, or even just driving down the road to work or driving to the grocery store and you turn on your radio. We cannot help but to hear things of such magnitude, and the numbers are through the roof. They're not just through the roof, they have exceeded the numbers that were first even given. I mean, no one thought, except for the experts and the scientists, that we would be reaching the millions and millions of cases that we have, and nearing 300,000. We're just short of probably 60, 70,000 from being 300,000 deaths in our country. And that is way too sad. Um, it's just terrible. Glad you're doing a little shopping there. Hey, there's nothing wrong with that. Yes, new restrictions, unfortunately, I believe, will be going into place because of the fact that our numbers are just through the roof. And if we don't get some type of control, folks, on this pandemic, um, it will be more devastating than what we have seen already. They've already said that what we are going into in the next few weeks, into the next few months, is called hell. And if hell looks anything like what I'm seeing right now, I definitely don't want to go there, don't want to be any part of it. But we have everything else, our daily lives and what have you, that we have to contend with, and add in the holidays, add in perhaps job losses, add in perhaps evictions, add in everything else on top of COVID-19, the coronavirus as we know it. So um, I'm going to put it to you this way. They said that there is light at the end of the tunnel, and we're beginning to see the light at the end of the tunnel. But I'm going to tell you now, in my opinion, the light is so damn dim until, I don't know, it looks like a little speck of something that's shining way down yonder on the other end. So uh I'm assuming, and I'm going to take the experts at their word, and I'm assuming that is actual light that I'm seeing, just a little bit of a flicker or a little bit of a spark that's down there at the end of the tunnel. But we have such a long way to go. But we are getting there. And unfortunately, it has cost many jobs. Um, Many businesses have gone under. Many more will continue to go under. And let's not forget about the many lives that we have lost, that we did not have to lose. The good news is that almost on every front, the treatments are becoming better, as well as the vaccines that are on the forefront and on the cusp of being released to the general public. Now, what that means is it is definitely. Wow, I sure am going to say a prayer for you, Tim. I hope not. Um, but right now, we're in some tumultuous, uncertain times, that's for sure. Um, but the good news, like I said, is arriving just about on every front. And with that being said, we have a better understanding, and I'm going to say we a little bit loosely, because it's some of us that are in the field of expertise now have a better understanding of this virus, having worked so hard expeditiously in a manner in which we have never seen before in the medical and our scientific field in our lifetime on this pandemic in order to try to get to some type of rectification and try to rectify this situation that we have let get out of hand. And unfortunately, we did not have a leader at the top to quantify or to signify what needed to be done as far as the American people. You know, if we would have been told, and some people would have been able to grasp that a little bit more, because some people hear and listen to the president and they go off of what the leader in chief has to say. And it's unfortunate that we did not have such a leader in chief, but like I said, good news is on the way, and good news is all around us, because now we will be having leadership that we haven't seen before in 4 years. And this fresh new leadership, I think, will do a very good job with what they're going to have to work with. Now, don't be fooled, y'all, that the leadership that is up and coming into the White House in January will definitely have a lot of obstacles and hurdles to cross and to go under, over, and through. With that being said, it will not be an easy task at hand at all. But I think that President-elect Biden and Vice President-elect Harris will try their level best to work within the confines of what they're given, and will try to do their very best at what they have as far as the resources that will be made available to them, and with different and various legislations that can be passed through the House and the Senate. Of course, we have to go through the turtle. Hey, Dallas, nice to see you, man. Of course, we have to get around the turtle, Tricky Mitch McConnell and his gang of folks. But, you know, as the American people spoke a few weeks ago, they will speak again. And of course, I want to let you know tonight that God is God, and He is real, and He is alive and well. So I'm not going to harp on religion. I'm not going to continue to harp on politics, but I'm going to move right into how serious this time is as far as the trials that we are going to see taking place in the very near future with the vaccines, and how the Food and Drug Administration is going to give the go ahead in order to release these two drug companies, Pfizer and the other one that skips my memory right now, and it's on one of these post-it notes, but I just dropped them onto the floor, so I had to pick them all up, and now they're out of order. But anyway, that's just the devil, and I'm going to say, devil, get under my feet, not tonight. But if these things hold up and hold firm, it will definitely be a game changer where COVID-19 or the coronavirus is. We must continue to hold our constituents, though, however, the new ones and the ones that were reelected and the ones that were not up for reelection but that are still existing in our local governments, we must hold them accountable and their feet to the fire in order to do the right thing by their fellow citizens, because we are the people who hire them and we are the people who can fire them. So with that being said, I want y'all to take a long pause and to think about what it means to you to have family, and what it means to you and yours in order to be available to them, or to be. I am yearning. I don't have much family at all, but I am yearning to go home for a visit to New Orleans. I'm yearning to see a few of my Georgia, where I reside. I am yearning to go into some of my favorite little restaurants who have managed to survive uh, the pandemic, but I can't right now because it is unsafe for me as well as it's unsafe for others too, because these are places that have that are indoors. And speaking of indoors, that's going to lead me to what it means again to have your family and what it means to you and for your loved ones to be safe on this upcoming Thanksgiving holiday. Thanksgiving, y'all, is one day. It is only one day. And fortunately, that one day is not necessarily going to make us or break us. We have the technology that we can reach out and we can make a phone call. We can reach out and we can call someone up on Skype. We can call someone up on Snapchat. We can call someone up on you know Duo for Google. We can call someone up on our iPhone and do a video chat with them. In fact, we can have even a Zoom call or a Zoom family call or a Zoom family Thanksgiving if necessary, with everybody live at each and everyone's domain or their house, and still see each other. We may not be able to hug each other live and in person, but we can do the virtual hugs and what have you, because trust and believe there will be a day that we will get to be together again real soon. To do these things, but right now, y'all, you have the power to choose with caution whether or not you're going to go to grandma's house, or you're going to go to your elderly parents' house or whomever's house, or let them come to your house, and they have not created a bubble and they don't live in your house. Therefore, we don't know who they've come in contact with, or vice versa. They don't know who you've come in contact with. And with that being said, we run the risk of infecting them. They run the risk of infecting us. Plus, add in the asymptomatic people that will never ever get sick, but yet still are carriers of this deadly virus. So, what are you going to do in order to try to keep your immediate family and friends safe? You know, me either. Me either. And it's a terrible thing, but hey, you might have to drive by, hang out the window, drive up in the driveway, or pull up to the window, or pull up to the front door, and have them sit on the porch or come outside and prop a chair down in the yard and sit there and talk to you. Something is better than nothing. But the CDC has said, y'all, that um it has been definitely proven, and unfortunately, we've had members of opposing political parties that has debunked wearing masks, but it has been proven, and now is a proven fact, that masks can save lives. It can protect you, the wearer of the mask, as well as give protection against someone who is not wearing the mask and you are. So I mean, it's a two-way street. We have choices to make in life every single day, period. So are we going to let this holiday, hinder us from continuing to keep our loved ones safe? Or are we going to have these lavish parties and these big soirees of Thanksgiving meal get-togethers, and knowing full well that someone or some people in that particular group of people or that particular setting has that virus and could potentially wreck your whole rest of your year? Because trust and believe, you know, I would much rather talk to them on the phone, see them on a Snapchat video, on a Zoom call or have a little Zoom meeting with the whole entire family or friends or whatever, and get together that way, or tell them, hey girl, hold up that salad, let me see what you eat, let me see your turkey, and they pass that camera around and you chuckle and laugh and have a little fun that way, than to know that in 14 days after Thanksgiving is over with and we're into fucking December, and you got your relatives dropping like goddamn flies, and then you can't even go to the hospital and visit them because you might be sick yourself, or they're not going to let you visit. We have, the numbers are going through the entire roof, you know? So we run the risk of being shut down. Who knows? Unfortunately, the Trump administration said on yesterday, or was it Thursday? I forgot. It is Saturday evening, but they said that they were not going to have another shutdown. Now, there needs to be a shutdown in some states. There needs to be, I'm not saying shut the whole entire state down or states down, but there needs to be a really hard set of shutdowns done in some of these states where the healthcare systems are being overrun. I mean, what are we going to do when we run out of hospitals? Some hospitals have already run out of beds, y'all. You know, Thanksgiving, like I said again, is one day. So I want all of my listeners, all of my loyal subscribers, and all of my people who support me to think about what it is that you can do to help keep you and your family members safe. The CDC warns against large gatherings. They warn against having people who do not live in your household. That means people who do not live at your address in your house come over, traipsing through your home and what have you, touching things and doing the most, using the bathrooms, touching this and that, all the utensils at a Thanksgiving dinner or what have you, and then going home and leaving Corona behind for you to have to clean up a little bit later. Okay, or Corona cleans your ass up and puts you in the hospital, or even worse, 6 feet under the ground, or in a makeshift morgue parked on the side of a road in an 18-wheeler refrigerated truck somewhere waiting to be buried. I mean, let's not do that. Let's not even go there. Let's not even, I'm not saying to anyone right here and now to not to celebrate the holiday if that's what you do. But let's make certain that what we do, we're going to affect other people. Like myself, I don't have really to worry about that because I live alone. Therefore, I control who comes through that front door or who comes through this back door. Nobody's coming in here, you know? And I so badly want some friends to come over. I want to go to their house and hang out, you know? I miss that. And from someone who suffers from depression and PTSD, I mean, it's rough. And for me to come on and say, I'm not going to risk it, you know, that says a lot, you know, because truly I'm lonely. I'm tired of being cooped up in here or what have you, going out every now and again. I try to go out once or twice a week, maybe to the grocery to get a couple of pieces of fruit or something or whatever, and then going to a McDonald's and sitting in the damn parking lot to eat my hamburger, or going to the Wendy's, you know, or going park at the Quick Trip, which is a huge gas station, you know, after I leave the McDonald's, which is next door to the Quick Trip or 2 doors down at the Wendy's, go and park over there just to see a bunch of different people, see a bunch of different cars and different things. I'm tired of doing that, eating in my damn truck. I'm tired of that. But then when I come home, there's these walls like they're closing in on me. So no, I don't want to be here by myself either. But right now, we as a nation don't really have much of a choice if we want to turn this around enough so that we can next year get back to some kind of semi-normalcy, because it's going to take a big minute. And what I mean by a big minute, it's going to take a while for us to get back to normal. And I don't think we'll ever go back to normal 9 months ago. but we'll get back to some type of normal that we do recognize, and we can work with what we got and then add on and make some new normals. But it's dangerous, y'all. It's dangerous. It's very dangerous. The CDC, well, the Centers for Disease Control, same thing. CDC warns that people who refuse to wear masks and come to Thanksgiving dinner, they warn against that. They warn that it would be better to have it outdoors. Well, in some northern states, how are you going to have Thanksgiving dinner in a blizzard? Or how are you going to have Thanksgiving dinner outside and on the patio in the snow? That's impossible. Now they're saying that 6 feet apart indoors is not enough. That's sad. I mean, I don't know. I mean, when you don't wear a mask, I mean, you're flirting with COVID. You're dancing with the virus. You're flirting with death, actually, because it's already been proven. 200 and damn near 50,000 people just in the U.S. alone in less than 1 12-month period have lost their lives to the virus. So it ain't no joke. It's real. I don't think it's a conspiracy theory. I don't care what these foolish people say. It's real. There's no actors in this here. This is real. These are people that's been affected. Everyday people. We have reason. Yes, we do, to celebrate. Of course we do. We're on the cusp of having leadership in the White House at the top. We're on the cusp of having a couple vaccines that are supposed to be good. I mean, we're on the cusp of turning things around. But before we get them turned around, we can't let it go down the drain. What would we do? We can't let the work that we have all chipped in and put in the time and the effort, the losing of the jobs, the losing of some loved ones, the losing of friends, the losing of businesses and what have you. We can't let that go down the drain for nothing. We've come too far to turn back now because we're slipping. We're going in the wrong direction. Our numbers are steadily going up. They're not plateau going flat. They're going up. I don't even see a dip in the graph, the charts that were on TV. And when I went to the CDC's website, I don't even see, not even like a little point to where it's turning a little bit. No, the damn thing is going just straight up like a plane steadily climbing, in altitude, just steady going up. What are we going to do, y'all? What is there left to do except try to do the right thing? Now that we know what we can do to prevent or to help prevent things, why not do it? Why not? Let's try to keep our family members safe. Let's try to keep these people out of hospitals and what have you, because places are full. Doctors have become overwhelmed. The hospital systems, the emergency rooms, they're full. Add on top of the coronavirus, let's add in everything else that they're dealing with. Car wrecks, slip, trips, and falls, heart attacks, strokes, everything under the sun, including the coronavirus that they still have to contend with. You can't just turn those people away. What are they supposed to do? They're human beings as well. So we have choices that we can make. And I invite each and every one of you who may stumble across this video vlog, podcast, whatever you want to call it, to choose with caution, to proceed with caution this Thanksgiving into Christmas, into the new year. Proceed with caution. Because having a good time for Thanksgiving and going out there and doing the utmost and going to these bar rooms and clubs and what have you may very well be your last. You know, you can't social distance in a bar room. You can't social distance in a nightclub on the dance floor. You can't social distance when it's snowing outside and you're trying to eat some turkey and dressing and cranberry sauce. You got to turn that heater on. People that you hadn't seen in 4, 5, 6, 7, 8, 9, 10, 11, 12 months, whatever, they're going to want to kiss and hug. They're going to want to just go off at the mouth because they got a lot to say. They're happy to see you and what have you. Yeah, they're going to forget to put the mask on. Then what do? Then you're going to have to designate somebody or designate people to be the mask police at your house. Who wants to do that just to have turkey and dressing? You could have turkey and dressing any day of the week. Pick a Thursday and have a Thanksgiving meal. Every day should be Thanksgiving anyway. You know, it's unfortunate that the cases that we're seeing right now are not confined to just one region of our country, y'all. They're all over the place. Every state in this union, every state in the United States of America has increased numbers. So much so, like I said, until some states are asking people to forego Thanksgiving period this year. That's serious. Okay, when have you ever heard of governors and mayors and superintendents and council people and other constituents in your local in your local towns and counties and what have you, asking their citizens and their residents, because they care and because they want you to be safe, asking you to please think about not having people over for Thanksgiving, just your immediate family that live in your house? Think about how serious that is. Think about what those people were thinking about in their head to want to even go on the news or even hold an interview with a journalist so that they can write an article up in the Times Picayune or the Washington Post or the New York Times or what have you. Think about what they were thinking based on what they're seeing in their geographical areas of the country. You may not be experiencing it perhaps like Chicago, but then you might have a friend or a family member that's in Arizona or in Wisconsin where the numbers are through the roof already. But then you wake up this time next week and your numbers are through the roof as well, and your hospitals are being overrun. What are we going to do? What are you going to do? I mean, we're all at risk because we don't ever know necessarily when an emergency medical situation, y'all, is going to arise. Okay? There's slip, trips, falls, there's accidents, auto accidents, everything under the sun. People walk by and whole buildings fall down on them. Bricks off a building just fall. Bam, hit you in the damn head, knock your ass out. You splattered out there on the damn sidewalk and they got to come get you. Then they get to the hospital and they tell, oh, sorry, we're all full. But it's an emergency. They're about to bleed to death. You got to take them down the road. We don't have no room. Or they're trying to administer emergency medical treatment to you on a gurney in the back of the parking lot of the hospital because they have nowhere to put you. But they're trying to work on you to save your life. We all deserve better than that, y'all. So if we could turn it around by wearing masks, washing our hands, and social distancing and keeping our distance from people and staying to ourselves or staying amongst just the people that are in our household, can't we do that? Just this year, can't we do it? I know that we can. So I'm asking you, myself personally, to think about The choice is yours. Whether or not you'll have your 50 family members over, and your cousins and your cousins' cousins and your aunties and uncles and everybody under the sun. Hey, have them over. The choice is yours. But I'm just asking you to think about the people that will be coming. Think about those people when they have to go back home. Think about those people that may become infected. Think about the people who have to pass through the airports. Think about the people who are taking flights to get to you for Thanksgiving, that's only going to be there 2 or 3 days or whatever, or maybe 2 days. Think about that. All of the people they've come in contact with since the time that they leave their house to the time that they get to your front door. Think about this. Think about all the people who you come in contact with if you're still working on a daily basis, perhaps. Think about your elderly auntie that's 79 years old that's coming for Thanksgiving because she hasn't seen you in 3 years, because she only comes every 3 years for Thanksgiving, and you can't tell her no because she says she's insisting on coming. Well, think about it. How's this going to work? What are you going to do? So I'm asking everybody to take into consideration the next person, take into consideration your family members. We can try to stop every new infection by trying to do the right thing. And that is masking up, washing our hands, creating our own little bubbles with the people that live in our household. And hey, if it's just you, your dog, and your cat, if it's just you and your cat, or you and your dog, or you and your wife, or you and your child, or you and your husband, wife, and child, or whatever, or children, that's all. That's it. That's it. That's it. Grandma, auntie, uncle, cousin, the 15th cousin on your mama's daddy's cousin, brother side. They just gotta wait. There's gonna be other holidays. There's going to be other holidays. And you know what, y'all? When we get to the end and we really can see that light at that tunnel, that light shining bright, y'all, we can fucking create holidays. We can have a fucking holiday every day. We can create a holiday every damn day. You can name it Pat Day. You can name it PG Day. You can name it John's Day. You can name it Ted's Day, Tim's Day, Dallas Day, whomever's day. You can name it whatever you want. It could be whenever you want, and it could be for however long you want it to be. Okay? So let's get creative, y'all. But we got to turn this thing around, because we have come too far to turn back now and to let these numbers continue to go up like a ladder, like a window shade. we got too much at stake, y'all. Pfizer is on the cusp of releasing, a vaccine. There's another company that's on the cusp of releasing a vaccine. We got a lot going on. We got a new administration that's on the cusp of taking over the White House in January. That's 60 some days from now. We got a lot, to look forward to in a short period of time, and this too shall pass. This can be done. But I'm inviting each and every one of you to take a long pause and to choose with caution what you do these holidays and how you go about celebrating these holidays with gobs and gobs of people, because it's dangerous. And I wouldn't be on here, y'all, pleading and begging and asking y'all to take into consideration, to think about your family members and think about yourself and think about the impact that it will have on other people's lives, and not just yours, or not just the people in your household. If you have others coming in there, or you leaving your household and you going to somebody else's house, what are you bringing them? What are you going to pick up when you get there? What are you going to carry back out their house that you can't see with you back to your house? Understand what I'm saying, y'all? I know y'all do. And like I always say, you never have to get ready if you're already ready. If you stay ready, you don't have to get ready. Stay ready, stay woke, y'all. Go buy your stuff. Last week, I gave out my code for the Abada app. Out of the 30-something people that I contacted and let know, plus the people on my YouTube channel and everything else. And if they told anyone, I told 30-something people myself personally. And out of those 30-some people, I think it was 36 people, 38 people, was like 31 of them was able to get the free Thanksgiving meal, They spent their little 20 some dollars, and within 15 to 30 minutes, they say they got their money back. They were texting me, they were thanking me, different things. So I hope that any of you that did sign up or whatever, that you get your Thanksgiving dinner. You know, they were releasing it out in spurts. It was a collaboration between Walmart and Ibotta, and the cashback app. I mean, it worked. I had no problems with mine. And all the other people that I told, about it, that I know personally, like here in Georgia, several in Arizona, a couple of people down home in Louisiana, they was like, girl, it really worked. Yeah, I got my money. I got my turkey breast. And hey, it is what it is. That's perfect for me. I don't really do stuffing. I do dressing. Hey, I'm black. We don't make stuffing. We make cornbread dressing. So I'll be making that from scratch or whatever. But the things that, that I couldn't use or wouldn't use, I've already donated those, to some people who were glad to get it. And hey, I was glad I could be a provider and give it to somebody else who could use it. But moving right along, y'all, I'm not going to be on here very long. Like I said, I just wanted to come on, and I just wanted to definitely really send a message home that how important, this holiday season is, not just celebratory, but for health reasons and our well-being. We have to think about that. We have to. It is a must, because we're too close. We can't turn back now, y'all. There is a little bit of light flickering at the end of that tunnel way down yonder, but it's coming closer and closer and closer and closer and closer. And the closer it gets, we got to stay on guard. We got to stay healthy as we can. We got to do what we can to beat this. And now we know that masking up, washing our hands, staying 6+ feet apart, 12 feet, 10 feet, 12 feet apart, doing what we need to do can beat this, and we can save lives. I owe it to you. You owe it to me. We owe it to each other. Each one save one. Each one try to save one. Just do the right thing. All we got to do is put on a mask, put on some rubber gloves, put on some non-latex gloves or whatever. Wrap your hands up. Some places are really cold, so put on your regular wool gloves or whatever. Go to the grocery store, do your thing. I wanted to go to Walmart. There were so many people. It looked like Walmart was giving away stuff. I couldn't go in Walmart. I'm like, oh, hell no, it's too many people. I said, drove on out the parking lot this evening. Walmart doesn't close till 10. I'm not going back down into the Walmart. I'll probably try to go tomorrow. Might just get up real early as soon as they open. I think they open at 7. I might try to be there in the parking lot when they open. But I wasn't going in there this afternoon. Oh, hell no. It was people parked all the way in the, y'all know how big a Walmart parking lot is. And it looked like goddamn Christmas. It looked like fucking Black Friday. So I'm like, oh no, a lot of people are shopping earlier than they have before. A lot of people are trying to get the few little bargains that they have. Some people are shopping online. I don't know what they're doing. No problem, Tim. No problem, man. Look, you got to take a pause for the cause and what? Run to the room. But anyway, I mean, you got to do what you got to do. And if you don't think it's safe to go in somewhere, don't go, y'all. Don't go. Try to wait till the next day, or wait it out a couple of hours and then drive back over and see if it looks safe enough to go in there. I don't go in these stores when the parking lot is filled to capacity. I don't. When you got to keep going up and down the aisles in the parking lot trying to find a parking place and you end up parking to the damn near on to the street, no, that's too many people. When they're telling you that they are allowing so many people in the store, that's a lie. Because I can't tell. When you got that many people parked out there and ain't nobody sitting in the cars, they up in that fucking store. Okay? So I'm in the store, you in the store, let's just say 1,000 people in the store. Let's not say 1,000. Let's just say 500 people. Walmart can hold 500 people any day of the week. Okay? That ain't no big deal. Let's just say 500 people. That's 499 times of a chance that you could pick up on the coronavirus, even with your mask on. Accidentally get in your car, get in your truck, on your bicycle, your motorcycle, your tricycle, your scooter, whatever. Pull off that mask, rub your eyes, touch this, do that, boom, bam. Next thing you know, too fucking late. So I'm just saying, y'all, be careful what you do, where you go, and how you do things. We've been at this now for some months. So all of us should have some experience in washing our hands, wearing a mask. And y'all, please, when you see some of your family members, some of your friends, your distant relatives or whatever, and they wearing that motherfucker incorrectly, please tell them to pull that motherfucking mask up on their goddamn nose, over their fucking nose. It's supposed to go over your nose and over your goddamn mouth, not underneath your fucking nose. That right there sends me into another goddamn dimension when I see people. Oh wow, I was closed at 10. And it's supposed to go to 11, but I don't know, with everything, with the numbers going up, it might it might not make it to 11 o'clock this year. I don't know. But tell your people how to wear their mask properly, y'all. You don't wear the mask below your goddamn nose. I mean, that just, like I say, y'all, it sends me into another damn dimension when I see that. You got cashiers. I see people in the stores working behind counters doing the most. I took my ass into T-Mobile. Young man, he wearing his mask. I said, son, you think you might want to pull your mask up? Oh, ain't no big deal. I said, it'll be a big deal. Your ass laying down there in that bed in the fucking hospital. I said, because you know what? Mommy and daddy can't come see you. Girlfriend can't come see you. Your sisters and brothers and whomever can't come see you. Best friend can't come see you. It is what it is. You all alone, except for the people in the hospital. And I'm not even sure that they're going to take the best care of you because they fucking tired their damn self. And now I just found out you got some hospitals, they're so overrun and so overwhelmed until they're letting asymptomatic medical staff still fucking come to work. I ain't telling you what I heard. Why would CBS News and why would CNN have it on the goddamn news? You know what I'm saying? That's ridiculous to me. So, hell, you ain't safe nowhere, really. In the hospital or outside the hospital when you got all of that going on. So, y'all, please do what you got to do. Keep your friends, your family safe, and let's try to figure out what you're going to do for Thanksgiving and with who you're going to do it with. That's all I got to say. Y'all be safe out there. I know it's Saturday night, like I said before, and I'm going to say it again. From now until the end of the year, I will try to come on at least once a week, sporadically. It's not going to be necessarily on the Wednesdays like I promised, like I used to do every Wednesday at 10 p.m. I have a whole lot going on like everybody else. I'm trying to stay safe. I'm trying to combat depression. I'm trying to keep PTSD at bay. So I'm doing what I can do, how I can do it. And I'm grateful that God has brought me a mighty long way, and I'm just trying to do my best. That's good. I'm glad. I'm glad. I'm glad. I got it stacked up to the damn ceiling, Tim. I'm not lying. Every time I see some on sale or whatever, because now, don't forget, y'all, stores are starting to limit what you can purchase. In another 3 to 6 weeks, they said. I have a friend that works for Walmart that's in their corporate offices. They were saying that they're going to anywhere from 3 to 6 weeks, of course, limiting what you can buy as far as paper products. But they're going to start limiting again meat products. Only 1 pack or 2 packs of each type of meat, such as beef, turkey, poultry, things of that nature. So be careful. Purchase what you can while you can. Like I say, stack up what you got, what you can get. Yes, we definitely got to talk. Definitely, Tim. But stack up on what you can get when you can get it while you still can get it. Grab an extra pack of toilet paper when you go to the store. If you got an extra few dollars, get a couple of extra canned goods, get a couple of, extra roll of paper towels or 2, or whatever it is you can get, Buy some frozen vegetables. Those last quite a long time in the freezer, so, within 3 months, 6 months, those won't be freezer burn per se. So you can still cook those, dry beans, rice, your grains, everything like that. You still need to get a little bit of it to keep it on hand. Peanut butter is a good staple to have in your pantry. Honey is a good staple, rice, things of that nature. Tuna fish, canned meat, pot meat, Vienna sausage, whatever you eat. I'm not saying buy stuff that you won't eat or your family members will not eat, because that's a waste of your hard earned dollars. Buy only the things that you know that you will eat. Buy some things that you know that you don't particularly like to eat a lot of it, but you will eat it. Okay, purchase that too, so that when and if things become really, really hard, you can kind of alternate. Well, today is Dinty Moore beef stew. I like Dinty Moore beef stew. Tomorrow it's Wolf Brand chili. Well, I don't particularly like Wolf Brand chili, but I could put a few little seasonings in it or whatever and kind of spice it up a little bit to where I'll eat it, and hey, it's a meal, So I'm just saying, and these are just a few suggestions as I close out my talk tonight. Don't forget to stock up when you can and while you can. And don't buy unnecessary stuff that you know that you don't like just to say because it was on sale and you know you don't like it and you're not going to eat it. Don't buy it. It's just a waste of money. Hey, Aaron, how are you? Glad to see that you're on. Um, I'm just telling people, Aaron, again, as I close out and I do just a little bit of a recap, is choose wisely, y'all, for the holidays. The upcoming holiday, of course, we're looking at that's staring us in the face is Thanksgiving. You got a choice to make. You either going to have a few people over or you're not going to have a few people over. The CDC is asking for people to stay inside of their homes in their little bubble that they've created. That means the people who reside in your household. They're asking that we do that. Even if we could set out this year, this Thanksgiving, have, not saying not have Thanksgiving, because every day should be Thanksgiving, but be mindful and be aware of your elderly people that you invite or that you go into their house. If you are around a bunch of people every day during the week, and it's just your mom and dad that live alone or whatever, and you're gonna take your college kid that come home from college, your daughter, then the boyfriend and the girlfriend, and come home with him from college. You can't take all them people over there to your mom and daddy house or your grandma and grandpa house and all that craziness, because surely somebody has that virus, more than likely, and you could give it to grandma and grandpa, mom and daddy, cousins, uncles, aunts, and everything under the sun. Hey, Miss Monique, glad to see you could make it this evening. So just be mindful, y'all. We got a hard choice to make, but sometimes when we have to make these kind of choices, it could very well be, give me turkey or give me death. I'd rather give me turkey and I not go visit nobody and I just eat the damn turkey at my house and stay safe from the damn coronavirus and not infect anybody or get infected, that somebody gonna give me something to take home with me besides some damn leftovers, and they give me the coronavirus and I've taken that home with me and infect everybody else in my house, or take it to work and infect my whole staff or my whole office or my factory or wherever the hell I'm going. So just be mindful. It's not just our lives that we have responsibility for. It's a responsibility to have everybody's best interest at hand. We may not affect them one-on-one, but what we do can have an adverse effect on that family member, and it can be devastating, potentially devastating. So choose with caution. I'm not telling you not to have your Thanksgiving. I'm not telling you not to go visit and do whatever the fuck you want to do, because people gonna do it anyway. PG is just saying what the Food and Drug Administration is saying, what the CDC is saying, what Dr. Fauci, damn experts are saying, is if you have to have Thanksgiving this year, try to do it with just the people in your household that live at your address. You know, if I had to have Thanksgiving, I would have a drive-by. I would cook a bunch of damn food, and I said, look, you 10 of y'all come at between 10:30 and 11:30, because you know you got to lie to some people. Come at 10, between 10:30 and 11:30. I'd have that shit out in a big old ass box on the front porch. Hey, I'd have my storm door open and everything. Hey, the windows up. Hey, how y'all doing? I gotta talk to Bobo and cousin Uncle Doot and Uncle Ken and Nana and y'all can't come in. Y'all get y'all to goes. I have to go boxes for everybody and styrofoam packs, and I have some little name tags and shit on. Look at here, I have some turkey place cards on. Like you eating at the fucking table, have your name. I have some damn turkey place cards on that damn to-go box for your ass. I be the hand drawn some turkeys and shit on there. I'm telling you, you can't come in the house. No. I have me some extra chairs out on the porch, spread way out. I have me a few chairs out in the yard. And look, I'm gonna pull up this recliner and I'm gonna sit in this damn door and I'll gladly talk to you outside. But we ain't coming in. No, y'all ain't coming in the house. I'm sorry. You know, I ain't mad at nobody and I don't want to be mad at me. But if we just gotta have Thanksgiving, this is how we gonna have pass through and get you a plate. But the plate, just know, let me know. Text me when you driving down the street so I can set that down, the couple of plates out there that I got for you. I can set that shit right out there on the porch for you. You get out your car, grab that and go. Grab it and go. God bless you. Bye. All right. Moving right along. Then I had the next crew come. All right. These 3 people, these 4 people I didn't invite. Y'all come on over between 11:30 and 12:30. Y'all come get y'all plates. You know what I'm saying? Oh, fuck that. You can't come inside. Oh, that's Uncle Tim. Uncle Tim, 76 years. I don't give a damn if Uncle Tim 86 years old. Uncle Tim, you driving and you don't have cataracts and everything, and you done made it from your house across town to my house. You doing good, boo-boo. Okay, I'm gonna give you extra because I know you like pie and shit. I done baked you an extra pie. You got a whole pie by yourself. Here you go, boo-boo. I love you. Bye, Uncle Tim. I'll be waving to your ass. I'm serious. If you got it, y'all got to be creative, y'all. Please, let's all be safe. Tim said, I ain't having nobody over the turkeys. Oh my. Hey, I mean, I feel you because that's the way it is with me. I'm having that little turkey, that breast of turkey I'm doing and shit. Look, but if I'm going to take my neighbor a little plate across the street, that's a wrap. A ding dong, I'm going to text their ass. And I'm gonna ring their bell. I got me a nice little tote bag. I'm gonna hang that damn tote bag on their door. Now you can reach your hand out, grab that bag. It's gonna be some nice little plates in there. That's a wrap. I don't need to come in. You can tell me thank you. You can text me and say thank you or whatever. You even gotta say thank you. It is what it is. You know, that's a wrap. That's a wrap. You know, the Lord said to love everybody. He didn't tell me I had to like everybody or nothing like that. It's a family thing or whatever. It's Thanksgiving. I'm supposed to be thankful and I'm supposed to try to do what I can to help somebody else, and that's what I'm doing. So hey, y'all gotta be creative about it. You know, black folks, I'm talking about black folks. You know how we are. You know, some of us ain't gonna fucking listen. We gonna have 99 and a half people try to come to the house, you know. And you gonna have Uncle Ned gonna be drunk as Cooter Brown, and his ass ain't gonna want to wear that mask. And he don't like wearing nothing on his face and all that. So Uncle Ned, you can't come to the house. Oh no, look out the door and see Uncle Ned. Oh hell no, close curtains, close the door. We ain't home. Uncle Ned out there ringing the doorbell. You tell the children be quiet. Don't y'all say nothing. Well, mama, that's Uncle Ned. And we ain't home. Didn't I tell you? like old folks used to do years ago. They didn't want certain people at their house. Shit, they knew they was on their way. They'd close up their shit, lock their door and everything, put the car in the garage, turn off all the lights. You better not make no noise. You better not make no noise. There you go, Tim. Ain't nothing wrong with that. Sound good to me. Hell, let's do a Skype call and let's compare. But anyway, y'all, I'm not gonna be on here now and give me 5 more minutes, but just wrapping it up. But I'm just saying, y'all, we gotta be safe and we gotta be sensible about what we doing. We are about to turn the corner. We haven't turned yet because the numbers are steadily climbing, but we know what we gotta do. When you go to work, if y'all are still working or whatever, wear your mask. Don't put the mask underneath your nose. Don't wear the mask over your nose, you know, because this is airborne. We have to breathe and we breathing this shit in, you know. Do what you got to do. Do the right thing, and especially think about your elderly family members and your elderly friends and your elderly neighbors, Let's try to keep them safe and let's try to keep ourselves safe so that we can be around to really celebrate in 2021 next year. Hopefully, we will be able to have some normalcy for Thanksgiving. There's going to be other holidays coming up that we should be able to at least ease up a little bit and have a little bit more of, people over or do some things. But let's remain vigilant. We're not through the woods yet. It is what it is. Y'all be safe out there. If I will be on sometime next week again. You got to do what you got to do. Hey, McDowell family, I'm not sure who you are, but I'm glad you tuned in. I'll have to check you out. Looks like you have. Oh, okay. I see you got a strong arm there. Okay, there's nothing wrong with that. But just got to do what you got to do, and we all stay safe and we can get to the other side of this. But the light is down there at the end of the tunnel. I'm not going to take the vaccine just as it's being coming off of the out of the factory, but I will consider taking it, after some months or maybe perhaps a year. I will to try to, get some immunity against the virus. I can't promise that I'm going to take it when it first comes off the assembly line. No, I'm not personally going to do it, but hey, to each his own. Like again, to each his own with this. Choose with caution. Choose with caution. I'm not a non-vacciner where, I think vaccines or vaccinations are bad. That's not me at all. It's just that something brand new. I don't know what adverse side effects it's going to have or whatever with the underlying condition that I have. I have to be cautious, and nobody is going to look out for PG like PG will, but PG. So with that being said, y'all have a great rest of your weekend. Have a safe and productive week next week. And I will talk to you all again real soon. Hey, Chris. It's Chris. All right, man. Good talking to you. Good seeing you. Much love to you too, Aaron. Thank you so much. Thank you, Miss Monique. Yes, yes, I agree. After you see how it affects the first million people, yeah, even the first 500,000, because it's better to say, oh, like oh, you got me once, you won't get me twice. No, I ain't but one of me, so I ain't got 9 lives like a goddamn cat, So I gotta stay safe. But yeah, I'm gonna see what it's gonna do and how it's gonna do, and then I will decide, but if motherfuckers start dropping y'all like flies, then I can't. Yes, call me, Tim. If if they start, and heaven forbid they do, but if they start dropping like flies and it links to the goddamn vaccine, and we got a Houston, we got a problem. Yes, Chris, I'm still going at it. I'm trying to stay safe. I'm trying to do what I can do. But man, it's good to see you, pop it on, man. I'm glad you're safe and sound. I'm glad to see everybody tonight. Got a little special surprise from the McDowell family. That's awesome. Cool. All right, y'all. Y'all be good. Y'all take care. And please be safe. Talk to you later. Bye now.